Hey everybody, this is Dr. Sattler here again with your question of the week. Okay, so our question this week says, the nurse is performing a health screening on a 54-year-old client. The client has a blood pressure of 118 over 78, total cholesterol level of 190, and a fasting blood glucose level of 184. The nurse interprets this to mean that the client has which modifiable risk factor for coronary artery disease. So our options are 1, age, 2, hypertension, 3, hyperlipidemia, and 4, glucose intolerance. So first of all, what can we eliminate here? The question asks us modifiable. So only things we can modify or change. We can't modify our age. So we know that that is not going to be an option because the question specifically asks for modifiable risk factors and we can't modify our age. Can we modify our blood pressure, our cholesterol, or our glucose levels? Yes, by some of the things that we do, we can modify those things. So let's look at the blood pressure. The blood pressure is 118 over 78. Is that hypertensive? No. A normal blood pressure, we want to be under 120 over 80, which this one is. And so, a person could be considered pre-hypertensive if their blood pressure was their systolic was 120 to 129 or so. Stage 1 hypertension, if the systolic were 130 to 139 or the diastolic 80 to 89. And then stage 2 hypertension would be 140 over 90 and above. We're in crisis, of course, if we're like at 180 over 120 or something like that. So this person doesn't have an issue with their blood pressure at this time. It's 118 over 78. So hypertension would not be an issue for this patient. Hyperlipidemia. So let's see what their cholesterol is. Their cholesterol is 190. Typically, we want our cholesterol to be under 200. Under 200 is considered normal. This person is at 190. So hyperlipidemia would not be an issue for this person. Now, what about glucose intolerance? So their blood glucose level is 184. What is a normal blood glucose? So, and it's fasting. This is fasting. Fasting blood glucose, the American Diabetes Association wants you to be between 70 and 100. Fasting means you have not eaten for at least 10 hours. So a fasting normal blood glucose would be 70 to 100. A fasting between 100 and 125 could possibly mean pre-diabetic, and then a blood glucose fasting over 126 would be diabetic. Now, obviously, they wouldn't diagnose you just off of one reading, but if you had two separate readings on the higher end or two separate occasions, then you'd be more likely to be diagnosed. This person is at 184, way above the normal range for a fasting blood glucose, 184. So that would be our modifiable risk factor for this person to develop coronary artery disease. So as we stated, our answer was 4, the glucose intolerance. So let's read the rationale here. Hypertension, cigarette smoking, and hyperlipidemia are modifiable risk factors that are predictors for coronary artery disease. Glucose intolerance, obesity, and response to stress are contributing modifiable risk factors for coronary artery disease. Age is a non-modifiable risk factor. The nurse places priority on risk factors that can be modified. In this scenario, the abnormal value is the fasting blood glucose level, indicating glucose intolerance as the priority risk factor. Okay, so that wraps up this week's question of the week. Thank you for joining me. If you enjoyed this question of the week and you'd like to hear more like them, then please consider subscribing to my YouTube channel. Thank you and have a great day.